Hi everyone, welcome to Center of Balance Live. I'm Szenan-Balance from Center of Balance, the Acupuncturist. Now, today our topic is about endometriosis treatment. Well, if you're online right now, please give me a thumbs up and say hello to me. And please share this live video with your friends and your family. Share it in your social media, like if you're on Facebook, please share it. If you're on Instagram, please share it. If you're on YouTube, please share the link afterward. Right now, we're gonna talk about endometriosis treatment. Right. So, the main thing that we talked about yesterday about the symptoms, right? Is the pain. It's the pain that called unbearable pain that from the endometriosis. Right? It's very annoying and frustrating, right? So you want a quick relief from pain and other symptoms, like from the endometriosis. This condition can disturb your life. I've seen people that they couldn't get out of bed. That's how serious it is. Okay, not just saying that when the period happened and they couldn't get out of bed, because we discussed that endometriosis pain can come 1 or 2 weeks before period, and before and during period, So think about it. If your period is about 28 days, then that is 2 weeks before that. That is about half month, So some people really suffer from the pain and they can't get out of bed, and that's how bad is that, right? So really managing the pain and get rid of the pain is number one mission in endometriosis. We are not talking about the treatment for the silent, the silent endometriosis. The silent endometriosis, you won't realize it, and there's no pain. The only people want to treat it is when they come for, when they when they try to conceive for a baby, and they can't, then you have to deal with the silent endometriosis. Otherwise, you just leave it. Most people didn't know about it, right? Okay, so we all know that if you Google search it, and that endometriosis has no cure, right? But the symptoms can be managed. So we're gonna focus on manage the symptoms, and we know that by doing some lifestyle change, you can decrease or make the pain all gone. You don't have to suffer from the pain, right? And it takes a long time to really to manage the pain down to 0 level, right? But it takes probably just few weeks, or just within 1 week, you can see the difference from the pain caused by endometriosis. So medical and surgical options are available to help reduce your symptom and manage any potential complication. So your doctor first, they normally suggest you try conservative treatment. They may then recommend surgery if your condition doesn't improve. So that is, hi Kika, that is very, very common in endometriosis. But you do need to understand that they then suggest you do this surgery. It's not because they want to get rid of all the endometriosis and prevent it to come. It's just managing your pain, right? The surgery is another way to manage your pain. And when after the surgery, and I have patient that grow the endometriosis grow back quickly, right? So it doesn't actually prevent it. So what can prevent it? So since in the Western medicine that we don't know in the Western medicine what's causing it, but there's a term saying that there's a family history. Yeah. So when we know that about family, that is mostly come from the diet and your emotion. Diet and emotion, right? So we need to look after that, which means you have to change your lifestyle to really properly manage the symptom. Okay, manage the symptom. But I'm not saying they get rid of it, because that is not proof yet. You can get rid of all the endometriosis. But what happened in here is people will go for surgery, will seek for help, and on painkiller. That's because of the symptom of the pain, right? So by changing lifestyle, you find that it actually works better than surgery and work better than your painkiller, right? I have patients change the diet and it works very well for them. Okay. Let's say now painkiller, okay, and people get ibuprofen. Ibuprofen, you don't need a doctor prescription for it, so you can try over the counter. So it's quite common to use ibuprofen, but again, ibuprofen may not work at all, right? So what is the we talk about the common side effects of ibuprofen. A lot of people use it, so we name a few: stomach pain, burning, heartburn, nausea, vomiting, gas, constipation, and diarrhea. Familiar? Yes. So ibuprofen as a painkiller, it actually harm your stomach and spleen function. Hi, Veronica, how are you? So ibuprofen is a drug that a lot of people take it and they straight away get heartburn, constipation, and stomach pain. So when that happens, it's a common sense, you know, this drug is not good for stomach. It will ruin your stomach function, especially when you take it for a long time. Hi, Silik, how are you? Thank you for joining us. We're talking about the endometriosis treatment, right? Right. So the next thing that more commonly used, Veronica says, good, thank you, enjoying your presentation. Thank you. We just talk. All right. The next thing that more commonly used is the hormone therapy. What we say about hormone therapy, actually, they just give you the contraception pill, you know, to control your hormone. All right. And hormone contraception contraceptive decrease fertility by preventing the monthly growth and building of endometrial tissue, right? So we know that the pain is causing from the bleeding to the bleeding cycle, right? So when the endometrial tissues grow, and they need to fall off and become bleeding, right? So if the tissues grow on the other's organ, it'll be the same because of the hormone change and they grow. So what happened in here is they try to stop or control the hormone. So when you control the hormone, and that tissue won't grow, and if you can prevent the tissue grow, then what happened? You don't get to the state of painful period. You're not going to have a period, right? So, but I have to tell you this doesn't actually treat the cause. It just manage the symptoms again, right? Manage the symptoms. But changing that lifestyle is different. Doing acupuncture in Chinese medicine is different. It's totally different with this idea, all right? We won't give you any artificial hormone into your body to stimulate your body because you're not sure and what side effect will you get, okay? So one of the common medication of the hormone contraceptive drug is called progesterone, okay? And also called Depo-provera, right? So let's have a look. Depo-provera side effects, all right? The common side effects is headaches, abdominal pain, dizziness, nervousness, decrease in sex drive, gain weight. So what does this giving you? Headache. It means in Chinese medicines, the heart and the kidney control the brain. So when you get headache, which means it has a damage in your heart and kidney. That's how we think about it. That's how we get to the drugs, by the symptom. Abdominal pain, yes. Depo-provera is trying to stop the pain, but it causes another pain. So you don't know when you take the Depo-provera. It says injection, okay? It's not taking oral. It's injection. It normally lasts for 13 weeks, the first lot, okay? And you can't take this for over 2 years because it really ruins your cycle. And think about it. If your doctor suggests you get Depo-provera to manage the pain, and it also tell you can't do the injection for over 2 years. So what is the point to do it in 2 years? Why don't you find an option last for longer, and you can do it for longer if you want to manage the pain? What is the best way to do it? Again, I suggest acupuncture, Chinese herbs, as well as changing your lifestyle, and that will last longer, okay? And changing your lifestyle, it changes a lot of things. It changes your hormone, and when you get your hormone, when you get your bleeding, you have no pain, and a lot of people have done it, and you can Google search it, all right? Nervous, okay? You get nervous, you can depress. With this disease, a lot of people get depressed and anxiety because they're too scared of having period. They're too scared to the period cycle because they get pain, right? And they're so nervous, they are depressed, and you might put on more drug for antidepressant, right? To get into depression. And gain weight, is that something that you don't want to get that for, all right? A lot of contraception pill, if you by oral or injection, it always put people weight, put on weight. And when you put on weight, think about what happened. All this medication, hormone medication, a lot of them is trying to prevent you ovulating, prevent you to your ovaries to release the egg, right? When it stop you release the eggs, or the eggs doesn't actually release, and normally your eggs should release once a month. When it stop, it actually grow. It grow to somehow it prepare from little one, it come to the bigger one, then but it doesn't release. They each month it get more and more and more, and it's stuck in there. It can't release. What happened to that? That is what we call polycystic ovaries. It's stuck in your ovaries or the eggs. It's ready, but it's just not releasing. The egg is from the very small eggs. It start to develop and get to bigger and bigger and bigger. When it get to this big, and it release, it pop, and the eggs come out from the cyst, right? And then all this thing start to disappear. But what happened is the eggs inside it grow to that amount, and it stop in there because you're taking medication to stop it to release. Then that's why a lot of people have in the pill, and they develop polycystic ovaries, right? And how do we know that? Because a lot of people on the pill, and then they found out they have, when they stop the pill, they try to have baby, and they found out they have polycystic ovaries. And you may think, oh, okay, but a lot of people have it. How could you know it is from the pill? Because they're taking the pill for years, right? There's the thing that directly impact the hormone, and in theory, you know that. We know that. And other things, people go for IVF, and they involve a lot of drugs. Do you know that? So before they went to IVF, they test everything, and everything's fine, normal, and they couldn't find anything wrong with this lady and with the female patient. And after a few rounds of the drugs involved with the IVF, and they still couldn't get pregnant, then what happened? And they found out, oh, I'm sorry, you have a cyst right now, and you have multiple cysts in your ovaries. And they told the patient, yes, that is coming from the drugs that we've been using and stimulate your ovaries. So that happened. So that is why I was sure that after seeing a lot of IVF patients, and they told me that they didn't have anything, and then they went for IVF process, and then they developed with cysts. And therefore, they keep doing it. How do they do it? And some of them just give up because with the IVF, they always need to go for drugs, and it's going to get worse. It's going to get worse. And for this patient, they couldn't help it any further. It's very sad. It's very sad. That is a side effect of the drugs that we talk about. Okay. Now, this is most commonly depot is one, and that is another drugs called Danazol. Is again is another medication that used to stop menstruation. Okay, while taking Danazol, okay, the disease may continue to progress. It doesn't actually stop the endometriosis, the tissue to grow in other organs, right? So Testosterone can have side effects, including acne, and extra growth of hair, especially in your face, in your body, in your belly, extra hair growth. This is very, very common, or a change of voice. It can also decrease the size of your breasts, right? Or it can, it's very common that it dry up your the dryness in your vaginas, and those are very common thing that in the from the drugs. Okay, even worse is they get swelling in the hands and ankle and feet, right? And menstrual cycle change, like it may be spotting or the missed period, right? And that is all from the side effect of the drug. And mood swing as well. Okay, mood swing as well. So as you can see that all the hormone therapy drugs, it actually causing a lot of side effects. Okay, and you need to realize all the side effects. Okay, I'm pretty sure that if you heard about me saying in here, you won't remember all the side effects. But what happened is, if you have a patient, if you're an acupuncturist or practitioner, oops, sorry, I don't know how I did it in that way. Hi, Jagana, how are you? What happened is, if a doctor put you on any drugs, okay, be smart, okay, to ask what is the side effects of these drugs. You want to know. Okay, if the doctor too busy and they don't want to let you know, and somehow they rush you out, and Google it. All these drugs, medication are on Google. Again, when you get the drugs from the pharmacies, ask the pharmacist what is the side effect of this, or take out the thing. It actually made very clear on the package, in the inside. It won't be a big word in there. It's just a small there, and you need to read it through, and you need to think about it. It's your choice. Is you make your own decision, and you take the responsibility for yourself. You need to know. You need to understand what, by taking the drugs, what happened afterwards. And does it really, it can help your condition or not? Like in this case, all the drugs that you take is trying to manage the pain. What is your goal? Managing the pain. Is there any other thing that I can manage the pain without taking the drugs, because I don't want the side effect? And that is important. You need to know, right? So think about, I show you the acupressure point yesterday. If you can just run the acupressure point yourself, and what happened? To decrease the pain and without side effects. Is it what you want? Would you choose that, or would you choose the drugs? It's easy taking the drugs. You don't have to do any work for that. If I just put the drug in the mouth, swallow it, that's it. But again, that is an artificial hormone. You're not supposed to have that, but you take it, and it gives you acne. It gives you extra growth of the hair, right? It gives you stomach pain. It gives you swelling in your legs, and it may. Okay, I'm not saying that it definitely will, but it may. But do you want to take the risk, or would you do the acupressure point over here, or further on? by doing here again, we talked about that yesterday. That may work for you, it may not, okay? But most time it works. When it doesn't work, or you want to treat it properly, take it seriously, acupuncture treatment. Go to a proper acupuncturist and take Chinese herbs, and further on, change your lifestyle. Change your lifestyle, because changing your lifestyle, it can change a lot of things, right? All right. That's about managing the pain. All right. The last result, what are you going to do? If the drugs is not working, painkiller is not working, the last result, they would suggest you have surgery. And the surgery is what we call laparoscopy. Okay, laparoscopy is it's not an invasive. It's very minimally invasive surgery. It's used to both to diagnose and to treat endometriosis. Right. It is also used to remove the endometrial tissues. Okay, a surgeon may take small incisions in the abdomen to surgically remove the growth, or to burn the things off. Okay. So what happened here is the keyhole surgery. So they put one hole in here, two hole over here, in general. Okay, one hole in here in the middle, under the belly button, and over here. How do I know that? I haven't done the surgery, to be honest. I've seen a lot of patients come in, and I can see the scar. So it's just about everyone on the same place. One hole, the keyhole, a very small one, under the belly button, and two over here. Right. So it becomes a triangle. And that's common. Very common. If you're a practitioner and you see a fertility patient, and you find a lot of patients have this already, because they went for surgery and they come in and nothing's working for them, and it seems like we are the last results for them. Not the surgery. Again, because of the surgery, we talked about it yesterday and the day before. The surgery, when you have surgery, and it actually remove all the tissues, and when you remove the tissues, and the tissue need to heal, and it forms scar tissues, right? So for those patients, some patients really manage it very well after the surgery, remove endometriosis, and they felt good, to be honest, but it kept growing back. It kept growing, and we don't know how long. It may grow in few months time. They start to feel pain again, or some of them years. They can last for years. Right. So what is the best thing to do? I always tell my patient, after surgery, that's good. You have no pain right now, or just minimal pain. You really need to take care of your diet, changing your diet, because you may prevent all this comeback from diet, and as well as managing your emotion. So things happen. How do you react to it? Are you going to worry about this, be angry about it, keep thinking a lot about it? If there is no solution, what can you do? So you do meditation every day, yoga every day, sing a happy song every day, exercise every day. If those are helping you and you do enjoy it, you have to do it. Do something that is enjoyable every day for you, and you feel happy about it every day, because emotion is one of the bigger impact in any disease, that including endometriosis. Okay. All right. So for the last result, if patient doesn't want to have baby, or they have a few kids already and it's good enough, and they still have pain, and that is something that very rare. Not many people will do that, but the doctor may suggest, hey, let's remove your uterus. Yes, there is case too. It will recommend a total hysterectomy. That is the even last result for you. You remove it, it's gone. Everything's fine. Okay, because it's because you have your uterus and the cycle keep going. You have to have bleeding, and that's where it comes, causing the pain. Okay, so what do you think about this? Endometriosis in the Western medicine, they don't have a cure. Right? In Chinese medicine, I won't tell you I have a cure. No, I wouldn't say that. But I've seen a lot by changing diet, by do all the drugs. Oops, the Instagram gone. I don't know why. Okay, the Instagram just shut it down. I don't know what happened. Okay, now I really want to tell you this is managing a diet is better. So plant-based diet is what I suggest. Go and Google it. There's a lot of recommendation in how to become plant-based diet, how are vegan, and it really can help. And I help a lot of patients with plant-based diet. And apart from that, acupuncture, we do acupuncture, and we offer acupuncture, and we help patients with the diet change, become plant-based, and as well as giving them acupuncture. Okay, and I show patients to do acupressure point, and I show you yesterday, and I would like to show you it again to make sure that you get it. All right. Hi Kika, sorry it went off the on the Instagram. I don't know why, and I have to reopen again. All right. So the point over here, this area are going to help. This area are going to help any menstrual pain, that including pain from the endometriosis, right? So knee and ankle halfway, right? And another halfway, which is quarter, and a quarter from here down to the ankle bone, right? From here down to ankle bone on this area, right? So it's actually on the inside, which is on your big toe side rather than little toes. So over here, you need to find the sensitive point to work on it, right? How do you find it? Use your fingers or your knuckle, and go and press it, all right? Now you want to press on the bone as well. Be gentle on the bone and rub it, right? And then you keep moving to the calf, to the back, and especially that the point, the area next to the bone, right, in the edges of the bone, right, it's gonna be very sensitive most of the time. You need to work on that. Any point that's sensitive, give it massage, and go back on the calf area, it's all on the muscle, right? Then you need to work on those. Okay, for those areas, it can be very sensitive. You just need to do one side once a day. Each point, give it about 9 seconds. Press it and rub it for about 9 seconds. Then you go, if you massage over here and you find too painful, the next day you can't touch it, which means you do it very hard. Okay, you don't need to do that hard. It's not the more painful, the better. Sometimes, yes, if you have a lot of pain, you press it in here, it's so painful, then yes, it can help a lot. All right, but sometimes you overdo it, and when you overdo it, keep a heat pack over here so that it heal, and then you do the other side. right? You do the other side. Okay, that's simple, right? So that's the acupressure point that I suggest for my patient, and I do put needle on that area as well. Okay, get a sensitive point in there and put needle in. Yep, needle works very well for these conditions, and this is just one of the strategy for endometriosis pain. It doesn't if it doesn't work for you, we have other point for you, okay? And there is no side effects. There is no side effect for acupressure point and acupuncture, so it's very good. And again, even though you do all this, I'm not claiming that it's going to stop the endometriosis growing, right? It's the best way without side effect to prevent, to manage the pain, right? That's the first thing. And how do you stop it even better or prevent it come back again? If after surgery or even without surgery, plant-based diet. Plant-based diet, I found is the best, okay? And I have patients that since they changed to plant-based diet and everything settled down, and some of them, they come to me is they already become vegan and they have been doing plant-based diet by Google searching, and a lot of people share the story, and they come and tell me that, yeah, I want to get pregnant. You know, I have suffered from endometriosis. I've been changing my diet, and the pain has been controlled very, very well. You know, I said, how, what have you done? Oh, because I went online and searched it, and I became plant-based, and the pain's just about all gone. But my goal is get pregnant. So can you help with that? I said, yes, we can help with that. You know, so the acupuncture and Chinese herbs, and try to, what acupuncture and Chinese herbs do is regular the period, right? Because think about it, with endometriosis, you may have heavy period. And too heavy period is gonna causing you losing too much blood, right? And the iron will be low. And low iron is one of the cause of preventing that you get pregnant. Okay, that's another one. Kika said no milk, no eggs, or only no meat. Yes, no milk, no eggs, no meat. Plant-based diet means no animal protein. Eggs and milk got animal protein. Again, Kika, I keep recommend everyone to read the book, The China Study. And it's very, very valuable. If you read it, you understand what's going on. For me, in here, I just give you a information. Okay, Angela, you say, I think my endo is affecting my kidney. Can this happen? And is there a non-invasive way to find out? No, Angela, I'm sorry. Can you tell me about what is the symptom that make you think that your endo actually affecting your kidney? And where are you from, Angela? No, there is no invasive way to find out. The only way, to be honest, the only way is keyhole surgery, laparoscopy, to get in, to look at by viewing how serious is the endo going on in your organ. That's the only way. All right. But I do have to tell you that I think someone left comment in my Facebook and I can't see it because I can see that information about me too. Okay, I have someone. Let me check. Yeah, please let me know what symptom make you think that is actually from going to your kidney. I've ended up with doctor twice for kidney stone, but they think it could be something else, and my kidney have been hurting on and off. Okay, plus my endo has been playing up. I'm from the South Waikato. Thanks. Had a laparoscopy in 2011. 2011, that's what, 9 years ago. Yeah, it could be though. It may, because what happened is endo, we talked about that yesterday. Endo mainly affecting the organs in the pelvis, like bladder, ovaries, bowel, right, and the wall of the pelvis, right. Yes, it can go to. We have seen that people affected in the nose. Every month they get bleed nose with painful, with bleeding, and they get nose bleeding as well. It can be anywhere in your body, to be honest. Yes, kidney it may, but how do we know it? Surgery is the only way. Keyhole surgery is the only way. And that was 9 years ago that you have had you have done laparoscopy to diagnose your endo. And again, the endo it really grow. Okay, if you're in Waikato, in the South Waikato, you can come to a clinic, and fill in a form to let us check on you according to Chinese medicine to get to which organs out of balance, And again, Angela, as I said, a lot of patients come to me. Before they come to me, they change the diet. So you need to think about what you really need. And go to the book, The China Study. It will help you a lot to understand why diet is important for everything and what is in your diet actually causing the problem, and even just managing the pain, yeah. And if there is no kidney stone, if you have a scan, again, kidney stone, you need to run a scan. If they rule out it's not kidney stone, then it won't be a kidney stone, and yes, it may be causing from the endo. We don't know until you get the surgery, keyhole surgery, to roll it out. And it can be from others too, the pain in your kidney, it can be for other problems. Maybe inflammation. Do you have any blood in your urine? Is it burning when you pass urine? All these things we need to know, right, to be able to help you further. So any question? Any other question? So in our clinic, if you are in our clinic, we do we do online consultation. If anyone want to help, we can do that. We have this service, and we give you herbs, or we give you prescription, and you can buy it locally. And we have a free pre-assessment, which means you can call in, and we can talk up to 15 minutes to see whether we can help you or not. Okay. Nida said, I did ask doctor. Nida, what did you ask doctor about it? I'm afraid that I may not see all the question, the message that you guys did in there. Let me go to the Facebook on my computer and see. Make sure I don't. Oh, okay. I find that sometimes that on my cell phone, it doesn't actually pop up the message in time. Do you have clinic in Europe? Maybe no, Kika. I'm sorry, I don't have clinic in Europe, but there are a lot of You just have to Google and see what some acupuncturists around you and go there. Shall I send again? No, Nita, I can see that I can only see that I did ask doctor. I don't know what, there is no other message about, yeah, what is your question? Yeah, you can send it again. The last thing that I see is I did ask doctor, and the second comment that I see in here is shall I send again? And I don't see any others comments of Nita. Yes, you can ask again. Why plant-based diet sometimes give gas in the abdomen? Veronica, that is a very good question. Okay. Plant-based diet, it actually have a lot of fiber, right? So when the fiber in your bowel, it actually try to clear out all the bad thing out of bile, try to pass it out. Okay, that's one thing to understand, to explain why gassy. Okay, when it work a lot and it make you gassy, all right, it actually help your bowel to move properly. The next thing is sometimes the plant-based diet, some food that is not agree, your tummy won't agree with that, because your tummy has been the stomach and spleen function has been low. So even on plant-based diet, you may find some vegetable you won't digest it properly. It actually I have patient when they're on plant-based diet. For European, when we say plant-based diet and they say, what do I eat? Do I just eat salad? I said, no, don't just eat salad. You need to figure out what, because salad is about cold, it's raw, right? It's good. Like I have no problem to eat salad and eat raw, all right? But in Chinese culture, we cook everything, even lettuce, even tomatoes, we cook it to eat it. Why do we cook it? There's a concept in that. That's because when it's raw, you need more energy to digest it. When it's cooked, when you see all the cooked thing, it's much easier to chew. It's much easier to digest. When anything is cooked, when it's hard, it becomes soft. When it becomes soft, you put it in the mouth, you chew it. Oh, it's much easier, right? And think about it, it's much easier for you to chew in your mouth. It is much easier for your stomach and bowel to process, right? So when you process it, it's easier, so it doesn't give you gas. That's one way to understand. Another thing is certain food, like you say on plant-based, right? It gives you more gas. What some spice and they actually stimulate your bowel and give you gas. One of them is onion and garlic. Onion is more common. People have onion, they get more fat and more gassy, right? And beans. The reason beans in there is because beans has something that I can't remember what they call. It actually protect beans itself, right? So when you cook beans, if you want to make it easier to digest, you soak it in the water for overnight, and tip off all the water and put new water in to cook it. Right, and the thing is, it will come out into the water and you tip it off, and you will find that when you have all those beans after soaking and tip off the water, and those beans are not as easy to make you gassy. Beans, quinoa, chai, cooked with ginger and garlic, turmeric, cumin, pepper. Yeah, those are good. Sometimes I'm not quite sure what actually causing the gas, and especially beans, full of protein, and that some of them not easy to, especially when I say the beans, you have to soak it first and tip it fork, and they may help. They may help reduce the gas. Okay, let's see here. I did ask about the treatment of hot flasher that I suffer from the lady 13 years old. Nida, your question is, I didn't see the question though in here. To suggest certain group of point. Are you saying that hot flasher, the 13 years old lady get hot flasher? Okay. That's very young, no? Get hot flasher. And they may be, you need to rule out some problem first, okay? And maybe it's good for them to, because hot flasher normally get from what? When you much older, 49, 50, you know, menopause. And if a young lady, you know, 13 is just a girl, if they got hot flasher, and you really need to find out what's causing it, the first thing. Whether it's hormone out of balance. Oh, sorry, not 13 years old. Okay, about hot flasher, I have it 13 years already. Okay, I know what you mean now. Okay. First thing I would do on the Western side, okay, check your hormone to see what hormone out of balance. That's one thing, because when hormone imbalance, it causes. I'm the one have it. I'm 56. Okay, I do understand right now. Sorry, I completely misunderstood your question at all. I'm so sorry about that. It's my bad. It's my bad. Yep. So I have one. Okay. What point to use? Because I'm not the one who can take the pulse. I can guess some point for you, but what have you been trying? Because if we know that it's the hormone causing the problem, you know, normally it is hormone last 13 years. Yeah, it should be the hormone out of balance. So in acupuncture way, I can suggest you some point, but it may not work for you. Why is that? Because we're not sure the diagnose or in the Chinese medicines. In Chinese medicine, we are very focused on diagnose. If the diagnosis is right, then we choose the point for it, okay? And it will work. If the diagnosis is wrong, and I can, you know, people will say, well, all this point will work, blah, 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 but it may not work for you because the diagnosis is wrong, right? So my suggestion for you, a quick and dirty way, we call it, all three meridian from here, ankle to knee, you go for sensitive point. Any sensitive point that you can get, one needle. So it can be a lot of needles. So go 3 in meridian. So this is without diagnosing you properly, you know, but I can target all the organs from here to here, knee to ankle on the 3 in meridian, and just go palpitate all 3 meridian. If you can find any sensitive point, give it a needle. This is according to the image, because I don't know exactly what's going on with you, but I think treating the organs is one of the strategy that we would use for anything, that including hot flasher. All right, so needle the sensitive point, right, and try it out whether it works for you or not. You needle once every 2 days. All right, that's my suggestion, but we have to get more detail to be able to diagnose properly and to suggest you what point will work for you. Right? You can try it out this way. Yes, if you have many sensitive points there, choose those points and needle multiple needle. It is fine. It is fine. Okay. In Serbia, we change to water for beans. Okay, cool. But you see, in Serbia, when they soak water and tip it out twice for beans, that's good. In Serbia, we cook every day also. Yeah, that's good. Cook every day, that's good. All right. All right. Now, we're enough in here because it's about an hour now. Thank you very much, and we'll see you tomorrow. Tomorrow, Tuesday. Monday, I'm off work. I don't see patient. And Tuesday, I back to work half day, so we can do it in the morning. And coming up on Wednesday, I probably have to get up earlier to do this live video because and on Wednesday, I see my patient in the morning and only see my patient in the afternoon. Started on work for 1 o'clock, but because of I have more patients during the lockdown time, and we closed for 6 weeks, and more patient come in right now, so I may start early sometime. And normally I start at 12 o'clock or 1 o'clock, and now I have to start about 11 or 10:30, something like that, to be able to fit in some more patient. All right, but we'll see the time. But tomorrow morning definitely will come and for a live video in here. I'm not quite sure what topic is it yet, but we'll find out tomorrow. Okay, see you tomorrow, and thank you for being here with me, and stay awesome. And I hope you learn some endometriosis treatment and how to manage it yourself at home by changing your lifestyle. Stick with it, and some acupressure point that help you. Right? Hope you learned a lot today. Thank you very much, and stay awesome. Bye bye.